So I did my MBBS from Government Medical College, Raipur, then was lucky enough to get a seat for post graduation in surgery in Sion Hospital, Mumbai. Then I took a little bit of time to decide what area of surgery I want to work in. And in from 2002 to 2004, I ultimately narrowed down to oncology, and I did a fellowship with Asta Oncology Associates in Ahmedabad. Uh, there, I learned not just about the nuances of cancer surgery, surgical technique, but also about how to approach cancer, how to deal with patients, how to sit in a multidisciplinary boards, which is part of cancer treatment, and how exactly does a cancer surgeon think and operate. So those were very important learnings for me, in addition to learning about cancer surgery. And I mainly worked in cancers of head and neck, breast, and abdominal cancers. Uh, so cancer surgery is probably one of the trickiest part of surgeries, because it is still, we often hear finding the cure of cancer. Cancer is still considered incurable, but most of the patients that we operate, that we work on as cancer surgeons, are potentially curable. So it's a very hopeful field, but also there are, in spite of doing the best, there are sometimes the outcomes are not so good. So there's always a chance that the cancer will recur, no matter how early we catch it and no matter how good the treatment is. So it's also a very dismal part of surgical field, but it's a very challenging part. It needs a lot of knowledge. It needs a lot of knowledge of not just surgery, but also of the allied fields, of the entire human body as a whole, and very detailed anatomical and functional understanding of how a body works. In addition, one of the reasons for choosing cancer surgery, of choosing surgical oncology, was that not just 20 years ago when I started this process, even today, it is a very underserved field, especially outside of metros. The per capita number of oncologists versus the number of cases that are there in the society, there's a huge mismatch. There's a huge need for more people to come in and uh, serve these kinds of patients who are suffering, and who are actually sometimes suffering quite a lot because they're not getting proper guidance. So choosing oncology and choosing to be based in Raipur, Chhattisgarh, both these decisions were driven by the need that I perceived that such a career will does have in this geography and in this location.